The Caregiver Wellness U-Model is a conceptual framework designed to empower caregivers by encouraging a strength-based approach to their own wellness. This model aims to help caregivers enhance their well-being and increase their capacity to care for loved ones or clients by focusing on several key dimensions. Caregiver wellness involves continuous movement towards social, psychological, physical, intellectual, spiritual, occupational, and financial well-being, while also fostering empowerment and resilience. Let's explore each of these. Social wellness reflects the number and quality of social supports available to caregivers. This dimension encompasses interpersonal relationships and the ability to access support from family, friends, church, and the broader community. It also considers cultural norms, comfort levels in interacting with others, and opportunities to contribute to the lives of individuals within your community. These factors have been linked to various health benefits for caregivers.
I am very isolated, can't really leave the house, and get very little relief. The friend that calls me the most is not the friend I feel most comfortable with. The amount of family support is minimal.
Physical wellness includes all the activities that help caregivers maintain their health. Optimal physical wellness involves regular exercise, physical activity without pain, controlled blood pressure, abstaining from smoking, maintaining healthy nutrition and weight, and limiting alcohol consumption. These habits support caregivers in staying physically fit and able to meet the demands of caregiving.
I have a high-level but not well-paid, stressful job outside the home. I also have fibromyalgia, high blood pressure, and several other medical conditions. There is no one to help me with caregiving or to give me a break so I can take time off. Getting help in home is expensive and we have limited resources. I am burned out.
Occupational wellness refers to caregivers' satisfaction with their work and the extent to which their occupation allows them to express their values. Factors that enhance occupational wellness include generous leave policies, adequate dependent care, access to care resources, and family-friendly workplace policies. These elements contribute to a supportive environment for working caregivers.
My life is no longer my own. My son takes priority. I have a full-time demanding job as a fire and law enforcement dispatch supervisor. Paul's supply and equipment orders, medication, appointments, nursing issues, and insurance issues are also more than a full-time job. Paul has 24-hour nursing, LVN. However, the home care business pays very little with no overtime, sick time, holiday time, and have very expensive health benefits. Nurses only stay until they can find better work. Paul's nursing schedule has never been fully staffed. We have been dropped by 2 nursing agencies because Paul's case had too many demands for coverage.
Financial security is defined by having access to sufficient resources to cover the care and special needs of a loved one, as well as the needs of the family and caregiver themselves. Elements that contribute to financial security include insurance, Medicare, Medicaid, Social Security, retirement benefits, savings, income from employment, and other financial resources.
I have health insurance, and she has Medicare. No coverage for custodial care, and she needs 24-hour care. Off-label cancer drugs not covered by insurance. Little tax advantage to medical bills. Must meet 7.5% gross income for any deduction. Major medical center where my wife is treated is over 200 miles away. Travel there overnight several times per month. No assistance or tax advantages for travel costs. Always slightly behind on bills. Hospital difficult to work with. All want payments of $50 to $100 per month, have many per month payments due to visits to many hospitals, center, etc.
Empowerment describes a caregiver's ability to engage in and execute behaviors necessary for successful caregiving. It is a critical force that enables caregivers to effectively handle the tasks required to care for a sick or disabled loved one. Empowered caregivers are better prepared to help their loved ones live more fulfilling lives.
The amount of time it takes to get family members help in programs or ways to improve their recovery. Not very much help from social workers and staff, constant advocacy phone call, and work to help your loved one heal.
Resilience is a strength-based quality that allows caregivers to adjust and adapt to the changing roles and challenges involved in caring for a loved one or client. Caregivers who demonstrate resilience can respond to these changes in healthy and flexible ways.
I am a family caregiver, and even though there may be days that it takes all I can give, I would not give it up for anything.
Intellectual wellness centers on the insights and knowledge caregivers possess. This includes understanding the personal preferences and physical and emotional conditions of their loved ones, opportunities for problem solving and participating in care planning, and access to training, reading materials, the internet, and other resources that expand their caregiving knowledge.
Access to specialty healthcare professionals, public transportation, policies which are not family-friendly. The facility does not consistently provide updates about important matters, although they regularly request items that may not appear significant. It is like they think he is no longer our father. He is their client.
Spiritual wellness encompasses religion, faith, personal beliefs, and self-actualization. These aspects are associated with positive health outcomes, better mental health, less depression, and improved coping mechanisms for stressful situations.
The stress that is involved in taking care of your loved one takes such a great toll on one's mental and physical state of mind. I pray to God daily to give me strength and courage. I worry about what will happen to my son if something happens to me.
Psychological wellness includes positive coping strategies for stress and depression, problem-solving abilities, and effective communication between caregivers, their loved ones, and healthcare teams. These components are essential for maintaining mental health and building strong support networks.
Emotional stress leads to physical problems for the caregiver. Lots of guilt, resentment, anger, and sadness. Multiple strong feelings competing.
The goal of the U-Model is to express the importance translating self-care into actionable steps once you are empowered as a caregiver. Rather than focusing on where you may be lacking, it is important to first acknowledge what is being done right. Thus, you are encouraged to build upon your strengths and keep working to reach optimal wellness for yourself and your loved one or client.
Visit the Caregiver Wellness U-Model page on Caregiver Support Services website, where you can identify additional resources that may be helpful to caregivers. This includes articles and useful tips, also a caregiver trajectory with resources embedded there as well. Caregiver Support Services, where good caregivers become great.